welcome to our channel. Today in this video we are going to learn about medical coding. So what is medical coding? So generally medical coding involves transformation of healthcare data of the patients, like the disease, diagnosis, procedures and the services which are used during his treatment, into a universal codes called medical codes. And let us see what is the need of medical coders. So why the medical coders are essential? So first of all, remember the word revenue cycle management. This is an important aspect in the role of medical coding. So because of this only the need for medical coders came into existence, because in revenue cycle management in general, so let us see the revenue cycle management, where the insurance company or the payer, the main thing, the patient and the doctor, these are the three main roles. So the patients or the general people normally have an healthcare insurance policy. So whenever they are ill, they will visit the doctor, and the expenses, whatever the expenses the patient have, are covered under this insurance policy. So what the hospitals do is, they capture all the data like the expenses of the patient, then they send them to the insurance company or payer to claim the insurance. So then the insurance companies will cover the insurance coverage to the patients. So in this way the revenue cycle management will takes place with the help of healthcare insurance policy. So there are a lot of patients visiting the hospitals regularly. So the insurance companies have to pay the doctors for patients treatment. So in order to pay, the insurance companies have to read all the patient's data, the expenses. They have to check the patient expenses are correct or not in order to pay to the doctor. So for this, the medical coders are essential, because the insurance companies cannot read all the patient's data and the diseases and their treatment costs. So they use medical coders. So this is the main role of medical coders, to reduce the burden on insurance companies. Medical coders play a vital role where they convert the patient's data into alphanumeric codes or medical codes, and these codes are listed in universally accepted books for coding, especially medical coding like ICD, CPT, HCPS books. So these ICD means International Classification of Diseases as per WHO, and CPT current procedural terminology, American Medical Association. Next thing is HCPS, Healthcare Common Procedural Coding. So these are some of the codes. Let us see an example. For example, if a patient uses an ambulance for his treatment, then the patient is recorded use coding. The ambulance is recorded using the code given in the screen. Next types of medical coders or departments in coding: outpatients or inpatients medical coders, emergency department medical coders, surgery coders, pathology, radiology medical coders. So these are the departments in medical coding. So you may be placed in any one of the departments, either in a hospital or in a company. So let us see the growth in medical coding and the salary. So the growth is generally gradual, and for a trainee it is around 13,500 the initial pay, and for junior medical coder it is 16,000. Trainee means under the probation period, I think. And the next thing is senior medical coder, it is 20,000. Quality analyst 36,000. And for the process lead it is 75,000 plus, and for the manager level post in medical coding it is around 1 lakh plus. So these are the pay scale for different types of roles in medical coding. So I hope I have explained everything in clear, and if you have any doubts you can comment. And thank you for watching. The eligibility for medical coding is all life science candidates and those who are interested in medical coding. For more videos, do subscribe to our channel, and for job updates.